Greetings, kids and seniors of all ages. You may be wondering who I am. Well, it doesn't matter who I am. I'm here to tell you a tale. Gather round the roaring fire, and I'll tell you a terrorizing tale. To be honest, this tale is about a bone-rattling, horrifying condition. This condition is so bone-chillingly terrifying, it will shiver your spine and rattle your femurs. This bone-withering condition is known as osteoarthritis! What is this, you ask? It's sometimes called the wear and tear arthritis. Osteoarthritis is the most common arthritis. When the smooth cartilage between bones breaks down, joints can get painful, swollen, and hard to move. Osteoarthritis can affect any joint, but it occurs most often in hands, knees, hips, back, and neck. It can happen at any age, but it commonly starts in the 50s, and it often affects women more than men. This disease often starts gradually, slowly, and worsens over time. But there are ways to manage it, to prevent or minimize the pain and keep mobile. Look into the fire, look deep into its power, and I'll show you the horrifying condition known as osteoarthritis and how to treat it and how to prevent it.
Osteoarthritis review. Hello class, it is I, Caitlin, and I am here to discuss osteoarthritis today and what it's all about. So our first slide is causes. What does cause osteoarthritis? Cartilage at the ends of the bones gradually decays and deteriorates. Eventually, if all the cartilage wears away completely, the bones will rub on each other. So bone on bone action. It causes changes in the connective tissue that holds the joints together and attaches muscle to bone. It also causes... All right, the next slides will include risk factors. Risk 1 is older age. Risk 2 is gender. Women are more likely to get it than men. Risk 3 is obesity. The more weight you carry, the more strain you put on your weight-bearing joints, such as your hips and your knees. Fat tissue produces proteins that cause harmful inflammation around and in your joints. Fourth on the list is joint injuries from sport or from just any accidents you get in. Even if they heal, you're still at risk. Fifth on the list is repetitive stress from jobs or from work. Sixth on the list is genetics. Some people are genetically inherent to develop osteoarthritis. Seventh on the list is bone deformations. This can be because of malnutrition or you're just born that way. And the last on the list is metabolic diseases such as diabetes or having too much iron. Next slide pertains to complications of osteoarthritis. Osteoarthritis is a degenerative disease that worsens over time, often resulting in chronic pain. Joint pain and stiffness can become severe enough to make daily tasks difficult. Depression and sleep disturbances can result from pain and disability from osteoarthritis. Okay. This next slide will pertain to the diagnosis of osteoarthritis. During a physical exam, your doctor will check your affected joint for tenderness, swelling, and redness, and flexibility. To get a better picture of what is affecting your joints, your doctor might recommend you get an x-ray, MRI, blood test, and even a joint fluid analysis. Osteoarthritis can't be reversed. However, there are treatments to reduce pain and help you move better. Medications such as ibuprofen and Tylenol are for reducing the inflammation and pain. Physical therapy can show you exercises to strengthen your muscles and increase flexibility and also reduce pain. Occupational therapy can help you discover ways to do everyday tasks without putting extra stress on your already painful joints. There are also pain injections, cortisol injections, lubrication injections, realigning the bones if that is the issue, and even joint replacement. Lifestyle and home remedies can include exercise. Low impact exercises can increase your endurance and strength in your muscles in and around the joints, making you more stable. Weight loss is a big factor as well because having more weight does increase your risk. Movement therapy such as Tai Chi and yoga, this involves gentle stretching in combination with deep breathing. This can relieve stress and pain. Hot and cold treatment as well can relieve the swelling and inflammation. There are topical creams that you could put on that do help some people. Assistive devices such as gripping and grabbing tools or braces and shoe inserts. TENS machine treatments as well can relieve some stress and pain. And finally, you can do acupuncture, which helps for some people, and there are nutritional supplements you can be taking to increase your calcium and your bone density. Our final slides include the recommendations for exercise programming straight from the textbook. Osteoarthritis doesn't have its own little category, but I did look in the back and it suggested I just go to the arthritis and lower back pain section. So I did that. The first on the list is mild arthritis, follows the ACMS guidelines. Arthritis with disability or diminished physical functioning, basic CDD4 recommendations. Non-weight bearing repetitive endurance exercises involving large muscle groups is recommended. Knee extensor strengthening is also recommended. Core strengthening and attention to balance issues. Balance is often impaired with these individuals. Individualized exercises that meet each person's unique needs, because osteoarthritis is different for everyone, might be affecting the lower back, the cervical spine, or the knees and the hands. Everyone's different, so you're going to have to program accordingly. Finally, our last 2 points are moderate intensity, walking sufficient to maintain independence and quality of life. And the last is supervision by a physical therapist is recommended. So there you have it, folks. This is all it is to our osteoarthritis presentation. Fitness montage time.
All the things that I know you like, making good conversation. I gotta handle you just right. You know what I mean. I took you to an intimate restaurant, then to a suggestive movie. There's nothing left to talk about unless it's horizontal